Welcome to tonight's webinar. My name is Melanie McKinney, Programs Coordinator for CAN-Do Multiple Sclerosis. Thank you for acting on the belief that you are more than your MS by attending tonight's webinar, Environmental Factors, How to Influence the World Around You, presented by Patricia Kennedy, Registered Nurse and Nurse Educator and Programs Consultant for CAN-Do MS. Dr. Deborah Miller will not be able to join us this evening. CAN-Do MS is an innovative provider of lifestyle empowerment programs for people living with MS and their support partners. We empower people to move beyond their MS by giving them the knowledge, skills, tools, and confidence to adopt healthy lifestyle behaviors, actively co-manage their disease, and live their best lives. Please visit the CAN-Do MS website, mscando.org, where you can register for upcoming webinars and view archived webinars. Check out our CAN-Do MS lifestyle empowerment programs, including our CAN-Do, Take Charge, Jumpstart, and Jumpstart in Motion programs. You can also share your CAN-Do promise, and you can learn ways you can contribute to or get involved with CAN-Do MS. And a few items before we get started this evening. Questions and comments will be addressed at the end of the presentation. We will answer as many questions as time allows. And you can post your question by typing in the chat feature, which is located on the left of your computer screen. To submit a question, type in the small box that says Chat with Presenters. And you can listen to the live webinar through your computer speakers rather than having to call in. This presentation is being recorded and it will be archived on CAN-Do MS's website. All of our monthly webinars are archived on our website and you can view them again at any time. You can also view the webinar schedule and register for upcoming webinars. And those of you who are attending live tonight, you'll receive an email with copies of tonight's PowerPoint presentation. And please also complete the evaluation at the end of the webinar. We value everyone's feedback. And we have a wonderful speaker lined up with us for tonight's webinar. Pat Kennedy has been working in the field of multiple sclerosis since 1987. Initially, she worked as a nurse practitioner in a large comprehensive MS center and now works for CAN-Do Multiple Sclerosis as a nurse educator for staff and community and as program advisor for our organization. Pat sits on the Client Education Committee of the National MS Society. She is president of the board of the International Organization of MS Nurses and is certified as a multiple sclerosis nurse. And she serves on the editorial board for the International Journal of MS Care. Pat has had the opportunity to speak to people living with MS as well as professional audiences internationally. She contributes to many publications and books, and she's the editor of a new book written by a multidisciplinary team of professionals who work as staff for CAN-Do MS. The book is titled The CAN-Do Multiple Sclerosis Guide to Lifestyle Empowerment, and it's published by Demos Medical Publishing. And we'll talk more about the book at the end of the webinar. And before we get started on tonight's presentation, we want to learn more about you. So I just put a survey here on the screen. If you could take a moment to let us know more about you. Great, we have some support partners and healthcare professionals on with us this evening. So thank you everyone for joining us. And with that, I will turn the presentation over to Pat Kennedy.
Well, good evening, and I'm so happy that you all joined us tonight. And this is an interesting topic tonight. We're going to talk about the world around us and what effects that might have on your MS. So many programs are focused in on MS the disease or MS the treatment or how to manage symptoms, and they're just more medically oriented. And this program tonight is wanting to give you information about what to think about that goes on in life that may have an impact on your MS that you may not even think about. So that's what we're going to be focusing on tonight. Let me get this right here. So all of you can remember when you were diagnosed. And many of my patients have told me, well, yes, it was at 3 in the afternoon, and on this day, in this year, and they have it, very clearly in their minds. But I think what you all can remember is, you heard those words MS, and you may not have heard much after that. But what you also might have heard at that time was that we in the medical profession really don't know what the definitive cause of MS is. And we also, at this point in time, don't have a cure for MS. So those are two things that are kind of shattering when you hear them. And hearing the diagnosis is one thing, and then hearing those words are something else again. And so what is that impact when you hear that? And each of you could probably write me a book about that. But basically it boils down to that most people tell me that they feel that they don't have any control. Here's a disease that we don't really know what causes it. We don't have a cure for it. I feel out of control. Something is taking me over and moving me along, and I can't stop it. Many people tell me that they feel absolutely helpless, that there's just nothing they can do, and how helpless that must feel, and that the future looks quite bleak. Certainly the future it's a big unknown, but it looks bleak for many people because they may have some misperceptions or have known people with MS, and they immediately paste that picture into their mind as far as what MS is going to look like for them. So we're going to talk tonight about some things that may help you realize that you actually have some control with MS. Having MS is not something that should make you feel totally helpless. There are some things about MS we still can't give definitive answers for, but the future does not need to be so bleak because we know so many more things today than we have known in the past. So know, please, that you yourselves can enhance your health. And this is something that is in control. And when I say health, I'm not talking about your MS alone. I'm talking about your health in general. And you certainly have the ability, each and every one of you, to make some lifestyle modifications. So there are many things that all of us do in life that probably aren't the healthiest thing that we could possibly do for ourselves, and you can make changes in those areas and therefore give yourself an edge for your future living with MS. And when you learn how to make these changes and then actually incorporate these changes in your life, that actually makes you feel as if you have that sense of control back again. And that's what we're talking about tonight. So when you experience that sense of control over things that you have done for yourself, decisions you have made, it's very empowering. It's very, well, gosh, if I can do that, I must be able to do more. And that's that word empowerment. And empowerment will allow you to improve the quality of your life while you're living with MS. So when we talk about experiencing good health, what does that mean? There are risks for all of us for many significant health problems. And many of these health problems that we're all at risk for, we can make modifications to our lives that will improve that risk for that disease. And many on TV, you see this all the time, campaigns for prevention of heart disease or stroke or high blood pressure, cholesterol, diabetes, cancer. We see things all the time about that. And many people still, though, seeing all that, they still feel like that's inevitable for lots of people. And so they aren't really grabbing onto that and saying, well, this is something, I don't want to have a stroke, so I want to do this, and I'm going to make some modifications to do that. I think many people sort of hear about it, it's sort of someone else, and so they really don't delve into all those measures that they could to make their lives healthier and then avoid some of those conditions. There are, however, in spite of all the things that over which we do have some control, there are some things that we can't control. And that has to do with age issues, your gender, your family history, perhaps your race, and your previous medical history. Those things we don't have that sort of ability to modify, but we certainly can modify some of our lifestyle issues. But to experience good health, you must be a participant. It doesn't just come to you. You have to kind of grab it by the horns and do some of that yourself. So when we talk about prevention, we want you to think in terms of, all of us to think in terms of, modify those factors that can be modified. If there are things we're doing that probably aren't the healthiest for us, what can we do to prevent that? Be aware of environmental influences that can play a factor in health in general and specifically in MS. Be informed about those environmental influences and make lifestyle choices that will have that positive influence on your disease course and your health. So when you think back to the I have no control, this is all ahead of me and it looks really bleak, realize that there are many lifestyle choices that you can make and that will have an impact on your disease course. And these factors will in fact allow you some control of your MS and how that is for you and how your life with MS is going to be. So first of all, we'll talk about taking control of thinking. And thinking is a huge issue. And if you think about, you were told you had MS and you felt like you were out of control, and so immediately your thought goes to, I have no control over these things, which then leads to anxiety. And if you think only of those things over which you have no control, your anxiety level is going to be huge. And you're bound to be anxious anyway, but the more you dwell on that, the more anxious you're going to feel. And it's going to be worrying about the future. You're going to be, get real concerned about that and then not be able to take any steps forward. So worrying about the future is a huge issue, but you need to, I encourage you, to seek out those areas where you do have control. And you'll, acknowledge that there are going to be some uncertainties that you're going to face, but then acknowledge that there are some areas in which you do have control. And if you take that, your anxiety level hopefully will reduce to some degree. And as time goes on and you have success in seeing that some of these things are working for you, that anxiety is going to become less and less and less. What are some things you can do just to relax your mind and to make you feel less anxious? Well, you can do things like relaxation, do a muscled relaxation where you're trying to do some exercises that you try to get your body to relax. Meditation is certainly one of those areas that will help to lessen anxiety, and guided imagery. But there are many others. Sometimes when you're kind of in the depths of that thinking and that anxiety, it's helpful to enlist the help of a counselor, someone who works with people who are undergoing either depression or anxiety, and see if they don't have some other hints for you as well. So you can take control of that thinking, and you can, in your mind, begin to bring in some positive thoughts and be able to move forward and open that window of what things can I do. So the next thing is take control of exercise. And, for some of you that have had MS for a while, you probably have heard some of this before. For others of you, you may not have. Or it may have just sort of gone in one ear and out the other because exercise just isn't your thing. We talk about exercise for those modifiable risk factors for heart disease and obesity, strokes, and high blood pressure. And maybe we hear it so much that we think, well, yeah, if that was me, I might do something about that. But oftentimes we don't step in sometimes until after the problem has arisen. But there are also positive benefits of exercise with living well with MS. And it isn't just let's get out there and exercise and make our bodies fit, although that is huge. But that movement in exercise is beneficial for both the body and the mind. But in addition to that, it's thought to have positive effects on brain function as well as cognition. And when we talk about that, what is thought today is, in the world of exercise, that it may help to increase our cognitive reserve. And so you hear about this now in aging, and there are many of us as we move along in life, we're getting older, and we're beginning to notice some of those effects of aging. And exercise can help us to build that cognitive reserve so that if we have little bumps along the road, we may dip down, but if you have some of that reserve there, you're not going to dip as far, and you can come back up again because you have that reserve there to strengthen your mind and your thinking. So these are some of the things that happen when you exercise, in addition to the fact that it helps with many of your MS symptoms, and it helps you feel better, it helps you sleep better, it helps you eat better. It has so many benefits. It is not just merely somebody saying you really ought to exercise. It has so much power in helping you live with your MS. Then we talk about taking control of weight. And I know we all hear about the big push for, as a nation we're overweight and obese, but we're also underweight. And so both being underweight or overweight can be problematic in MS. And if we learn to manage so that we can cut down on weight if we need to, or maybe gain some weight if we need to, that's going to improve our overall wellness, and our management of MS symptoms are going to be better if we're in a normal weight level. Often you have the best intentions, but you just quite don't know how to get there. And sometimes it does help to talk with a dietitian to help you figure out what is it that maybe I'm doing that I could improve upon, what kinds of things can I add to the diet that I'm eating that will help me. And that will be beneficial for your overall health, and also might help you lose weight or might help you gain weight. And exercise, again, another area where exercise is helpful, can contribute to both positive weight loss, we all think about that, but also to healthy weight gain. And as people exercise, it increases their energy levels, it increases their mass, their muscle mass, and they might be able to put on weight, strengthen their bones, and in general, that will help with increasing their health. Also think in terms of if you're a person who requires some assistance in movement, maybe transferring from one place to another, or getting out of a bed or getting up the stairs or whatever, and you require other people to assist you, it's much easier to assist you if the weight is more in a normal weight area and not overweight, because that becomes pretty hard on your caregiver, on your support partner. So it's also important to think about weight and weight loss in those regards. Now I wanted to talk to you about this little study now that you see in front of you. There was a recent study that looked at obesity in young girls. And what they found, looking over a long period of time, was that girls who were obese, overweight, more than just a little overweight, but heavier than that, they found that it puts them at higher risk for developing MS later in life. So you think about that and you think, that's interesting. So girls that grow up with either parents or their siblings are going to be at higher risk for developing MS. That's one of those things that we know about MS, that people, children of parents with MS and also siblings of people with MS are at higher risk for developing MS. So if there is MS in the family, in parents or in the siblings, and there is a child coming along, if that child's obesity could be controlled so she doesn't become obese, perhaps then that will be a preventative factor for developing MS. So when you think, I have no control, here's one place that perhaps there is some control. I can help my child. I can help my sister and not let her become overweight and thereby increasing her risk for developing MS. Then we talk about alcohol. And again, these are all things over which we can choose to or choose not to. And, does MS directly affect MS? Well, in the sense of directly affecting the brain, directly affecting lesions, causing lesions to form in the brain, no. Alcohol does in any human. Drinking enough alcohol over time, it does cause damage in the brain, by the way. So if you have a disease that is already causing trouble in the brain matter, in the brain tissue, taking in large amounts of alcohol is certainly not going to help that, and certainly is going to increase the effects of that alcohol in a person with a brain disease. But alcohol definitely interferes with symptoms of MS. And those symptoms would be if you're having difficulty with balance in general. And you all know who have balance issues, that can come from your eyes. It can come from not having full sensation. It can come from weakness. It can come from any number of things. But you also know that if you drink too much, you get a little off balance. So if you have those other issues going on with your MS and you put alcohol on top of that, your risk of falling is going to be tremendously higher. We also know that MS can affect cognition or your thinking skills. And all of us who have alcohol know that if you drink too much, cognitively you're just not sharp. And you're not thinking well, and you're doing some things that are, just not you. And so if you have some cognitive issues and you add alcohol to that, that's going to be a problem. Many of us drink alcohol because we think it will help us relax and get to sleep better, and we'd have a better night's sleep. And so, have 1 or 2 or 3 or however many drinks before going to bed, going to sleep. And you know what happens? Alcohol actually interrupts healthy sleep. It may help somebody who's uptight and anxious to relax a little and they think that they'll fall asleep more easily, which they may. But does it help them to get a deeper sleep, a more restful sleep? And in fact, it interrupts that. And mood. Alcohol can help some people think that they are more relaxed, and I suspect that that really does work for many people. But if a person also has depression, alcohol can increase depression. So alcohol does have pretty negative impacts on MS, and especially the more alcohol that a person consumes, it can be a bigger issue. Plus, if you think about medications that you may be taking, not the disease-modifying therapies so much as many of the symptom-managing therapies, they don't mix well with alcohol. So there are reasons why alcohol would not be a good mix when you have MS. Then we look at something like smoking. And this in at least in the U.S. for sure is a huge environmental issue. And we do know from studies that smoking will cause a person who has relapsing MS to transition to secondary progressive MS more quickly than a non-smoker. So that alone would be enough to tell many people that if I'm a smoker, I have relapsing remitting MS, this is a really good time to stop. Because if you can put off that transition into secondary progressive MS, that would be a real benefit. Also, smoking can be potentially a risk factor for developing MS. And some studies have shown that smokers are at higher risk for developing MS. So again, you look at what are those environmental factors out there over which you have some control and over which you have some control in your MS picture. This is one of them. And also, children and siblings, brothers and sisters of people with MS, have an increased risk of developing MS. You know that just from the data that you've heard over time. But this risk will increase if they, as children, are smokers. So again, just like obesity in young girls, this is another thing that if you're a parent or a sibling of someone and they begin to take up smoking or talk about smoking, this is something that you may wish to say, that's not a good idea. And this is something over which you have some control. There was also a recent study looking at there are today reported more young women smoking than ever before. And we all know that women as a gender develop MS 3 to 1 or almost 4 to 1 over men. So if we have more young women smoking, and MS is out there, that may be one of the reasons why we see more women now developing MS. That's a hypothesis that isn't a definite, but it is food for thought. And it's something over which you might say, maybe that's something I should think about. And bear in mind that if you live in a family where someone else smokes, secondhand smoke carries the same risk as direct smoke. So this is something that you may want to talk about with your family. If there's somebody in the family that smokes, you may want to make that, have that discussion. So then we talk about working on communication skills, and you think, well, now what does that have to do with anything? What it has to do with is if you make some plans to take control of your health, and the impact of MS on you, you have to talk about that with the people that you live with or that you hang with. Because, maybe you hang out with a bunch of people where drinking on a Friday night is the big thing, and you decide, maybe I don't want to do that. Well, you better talk to your friends about that because they're going to wonder, well, what's wrong with him or what's wrong with her. If you're in a family and you've decided now that I really want to look at what I'm eating and I'm going to add this or delete that or I'm going to begin having more fruits and vegetables, whatever you make that decision to be, you need to talk about that with the family that you live with because they need to know. And I would just make the suggestion to you that when discussing this, you do it with the I messages. And so they understand that you're not saying we all have to do this. You'd like them to, of course, but you'd like to say, I really would like to do this for myself. And I would like to do this for my MS and to make my risks go down some. You might want to ask your family for their support, because that would be something in a communication regard that would be very important. Give them your reasons. They may not be aware of the reasons why you're making these decisions. But then you need to sit back and listen to the impact of that on them and hear what they have to say about that. And that's called communication. And so there may be some pushback. There may be some reasons why people may say, well, gosh, that isn't the way we do things in this family. And then communication starts. So you want to make sure that when making these decisions, they're not unilateral. They're certainly not trying to be punitive to the rest of the family. And in fact, you talk about it as a family, and you may be the only one in the family who makes this decision, but at least they'll understand why you're making this decision. Then we want to learn about vitamin D, and I suspect there's probably no one on this call tonight who hasn't heard about vitamin D. And we all know that vitamin D may play a role in our immune function. And there have been study after study after study that are indicating that vitamin D is more powerful than we ever thought before, but we haven't nailed it down yet as to exactly what it does. But we certainly are aware that it may be playing that role, and that role in MS and other autoimmune diseases. We also know that people that have MS, typically, if we draw vitamin D levels, tend to run in the lower levels of blood work. And so we see this over and over and over again. So for whatever reason, people with MS seem to have a lower level of vitamin D. There are many factors that may contribute to this. Geographical locations. I think if you've been around with MS for a while, you know that the incidence of MS is less the further toward the equator that you go, where there is more sunshine more of the time, and that there's more MS the further away from the equator you go, where you're more apt to see cloudy days, rainy days, cooler weather. And so that may be a part of it. Also, in today's world, we have decreased sun exposure. People with MS, just by nature of the fact that when you get hot, who wants to go out in the sunshine? But that's part of it. And the other part is that we all, because we're good followers, we slather ourselves with sunscreen, and we're not getting that full exposure to those rays from the sun that may help us develop our vitamin D in our system. So these are factors that may be playing a role in our vitamin D levels. If your vitamin D level, which is a blood test, a simple blood test that can be done by your healthcare provider, either your family practice physician or your neurologist. If it's low, that provider may recommend that you supplement your vitamin D. And here's the rub. We don't know exactly what amounts we need to supplement with. And I know of some providers who supplement with one amount and others that supplement with another amount. Some people do it on a monthly basis. The whole thing is a very uncertain science at this point in time. But the point is that ultimately supplementing is a good thing. But the full impact of vitamin D is continuing to unfold. So you want to continue to stay up to date, and you want to talk to your provider about what they know and continue to read and gather information from places like the National MS Society, who you can trust their information, and keep yourself up to date. There are many websites that you go to that may have secondary gains and may give you information that necessarily isn't correct. So you want to make sure that you go to those websites that are going to give you the good information about vitamin D. And I suspect as next year and the year after come along, we're going to learn a whole lot more. Then we look at osteoporosis. And all of us are at risk for osteoporosis as we get older. It just is something that we have learned over time. But there is an increased risk for people who are less active, people who have had to use corticosteroids over time, like people with rheumatoid arthritis or emphysema or MS. People who are not eating a calcium-rich diet, whether that's by choice or whether that's because of lactose intolerance or whatever, they have a higher risk of being low in their vitamin D levels. So when you have osteoporosis, thinning of the bones, this can lead to fractures, and it can lead to decreased function. It's harder to move about, and it can lead to pain. Osteoporosis is painful in some people. So we want to make sure that we do all we can to prevent osteoporosis. We always think of that as a female kind of a problem because women in the general population tend to see more osteoporosis than men. But in MS, men seem to carry that very similar risk for osteoporosis as women. So this is one where being a woman doesn't necessarily give you an edge up. So what can you do to prevent osteoporosis? Well, you see that thing on that list? Exercise. And the more that you exercise, putting weight on your long bones, your femur, the top of your leg, the lower part of your leg, if you're able to walk and utilize those, that's a good way to help to increase or decrease the risk of osteoporosis. Weight management, and this is where being very low weighted can increase osteoporosis, as well as being overweight. So this is something, keeping control over that weight is going to have benefits for you as well. And people with MS are much more apt to experience falls because of that being off balance or being weak. And if they have osteoporosis, the fractures are going to be more frequent. People can prevent osteoporosis by increasing calcium in their diets if they're able. And you may need to supplement with calcium and vitamin D. They come usually together most of the time. But first, you should talk to your healthcare provider. There are some risks that are being reported with calcium, and so you need to talk to your healthcare provider to see if that is going to be an appropriate thing for you. Now, here's an interesting finding, learning about the impact of salt. Well, we hear all the time, don't salt your food, try to buy foods that are lower in sodium, and you think, yeah, you know, I've heard all that. And it is true, and it's good for your general health, it's good for your heart health, it's good for your blood vessels, it's good for all kinds of things. But there have been 3 recent studies that have looked at perhaps a potential, it's only a small study, and more studies have to be done, but something for you to think about. Salt may have a potential role in causing MS. So if you think of no other reason to decrease your salt, here's another one. So dietary salt may be an environmental risk factor, and you should do it for your general health anyway, but certainly this may be another one. But there needs to be a lot more data. But it certainly isn't going to hurt you to limit your salt, and it's certainly going to help your overall health if you do that. So when we talk about controlling environmental factors and where you have some control over your MS, you want to be open to the many choices that are available and take the actions that you can do. I mean, if there are some things out there that apply to you and you can make some changes, what a great thing you can do for yourself. Be aware of what the environmental influences are over time, because this is changing. And if you go to websites where you get accurate information, you're going to be up to date with what new things are being found. And be willing to change your behavior, because if you can change your behavior, that gives you back that control over your health and your well-being with MS. So this is what I have to share with you tonight over environmental factors and what influence they play in your life. So I would welcome any questions that you may have.
Great. Thank you so much, Pat. Another wonderful presentation from you. We've gotten some great questions this evening. I've had quite a few people ask about weather and climate as an effector of MS. For example, humidity versus dry heat. Another person mentioned cold versus a damp cold. Don't know if you could address that.
I'd be happy to. Yeah, most of you know, and you've either for yourself or maybe others that you know with MS, that a lot of people really do not tolerate heat very well. And part of that has to do with that, well, just simply put, if your nerves become really warm, they don't function as well. Okay, so that's simplifying it a lot. But then you throw in humidity, and why is it that some people in a dry climate might not suffer from the heat as much as somebody in the humid climate? Humidity keeps you from having that natural evaporative cooling. If you think about what a swamp cooler is taking the water out of the air, taking the moisture out of the air is cooling. When you've been in the water at the pool and you come out and you sit outside in the air and the water evaporates, you cool down. Well, when you are in a humid climate, you're not as apt to evaporate that moisture off your body, and therefore you're going to keep that heat longer. So that's why people in the more humid climates may experience that. But on the flip side, some people have equally as difficult a time with cold. And during cold weather, they may experience more spasticity. They may not feel as well when they're cold, and especially if it's a moist cold. And that's not evaporative cooling, obviously, but there's something about moist cold that just kind of gets to your bones, doesn't it? I mean, we can all just sort of remember what that feels like. And for somebody who's sensitive to cold, that's going to be more problematic for them. So those are the facts. And so what you learn to do is kind of counteract all of that in the ways that you can, and whether that's through cooling devices, anything from a fan to a cold rag around your neck to a cooling vest to drinking really cool liquids that get down to your core and will cool your body. If you sit in a cool bathtub of water for about a half an hour, you're going to gain about 3 to 4 hours of cooling benefit. So those are some ways that you can combat the heat. I would also advise, if it's a hot and it's a humid day, maybe stay in air conditioning if you have that. And in the cold weather, it would be the same thing. You would try to bundle up as much as you possibly can. Warm fluids would certainly help, and not go out if you can avoid that.
Great, thank you. I had someone ask about, you touched on the vitamin D. What are some of the symptoms of taking too much vitamin D?
Wow, that's a really good question. The experts don't have a real answer for that. One study that was done that I heard at a meeting 2 years ago was that they really filled people up with vitamin D, and they never reached a point where they had adverse events. They didn't reach a point where people were experiencing bad side effects. But that doesn't mean there aren't any. That only means that in that study they weren't found. I suspect there is a level where there's too much vitamin D. And that's why I would encourage people to not just willy-nilly just go buy a bottle of vitamin D and throw it down. I would really recommend that you get that vitamin D level checked and under somebody's care where they can keep an eye on your blood level. And when you get back up into the normal range, then they can cut back on the amount of vitamin D that you're taking, so that you don't run that risk of zipping up to those high levels that we don't know what's going to happen. So let's be doing this with care.
Thank you. Another person asked about calcium. Are there symptoms of taking too much calcium? Can you take too much calcium?
Actually, you can, and I'm not sure that I can tell you what the symptoms may be that you might experience, but there might be symptoms internally in your body if you have too much calcium. And so that's why I suggested that you talk to your healthcare provider to find out if you're a candidate for taking calcium supplements. There may be some effect on heart function and other functions in the body, and but I can't speak to that because that's not my specialty. But I do think you need to talk about that with your provider.
Great, thank you. I had a few people ask about evidence of environmental pollution. For example, there's someone that I guess lives in a coal mining area who asked. Another person kind of mentioned hot tar, other pollution maybe from buses or trucks. Is there any evidence of that affecting MS?
That question gets asked often, so thank you for bringing it up. I think that there isn't enough firm data at this time that anything specifically affects MS. That isn't to say, however, that it may not affect MS, but perhaps we just don't know yet whether that does or not.
Great, thank you. And this is one that that we've been asked in the past, the dental fillings connection with MS, mercury in dental fillings. Is this something you would be able to address?
Yes, I can. This has been something that has been out there in the MS world for as long as I've been in MS, which a long time. But what I can tell you is that there does not appear to be any evidence, well, I won't say any, but minimal evidence that there's any effect from fillings or amalgams in your teeth that contain mercury and a person's MS. The American Dental Association actually has come out with a statement, which I would trust because they got a whole lot of dentists in a room and they all agreed, so that says something. But they all agreed that there just is not enough evidence to suggest to anyone that they have their dental fillings removed. There is some thought that if a person underwent removal of dental amalgams, sometimes underneath those old fillings you have some viruses and bacteria that are down there because they're old fillings, and sometimes those can kind of stir up your system and maybe even stir up a flare-up of your MS. So, if you have that, it's just not top on the list of things you need to do.
Great, thank you. And I've had a few people ask about preservatives in food, and for example, things that are sprayed on fruits and vegetables. Is there evidence of that possibly affecting MS?
That's an interesting question. I've not heard that there is. You mean like the waxy stuff on apples and that sort of thing? It is recommended for all of us, and just for our better health, to go ahead and really wash your fruits and vegetables well before you use them. I have read that waxy stuff on apples, etc., isn't particularly harmful, but it is recommended that you try to wash off as much of that as you can. But I've not heard anything directly related to MS. Great.
And also, actually, someone had asked about genetically modified foods, which has been in the news lately. Is that something you could speak to?
I think it really is interesting stuff. I've been reading that as well, but I think no studies have been done yet looking at that directly with MS. I think that the jury is still out about what place does that play in our world anyway, but I have not seen anything directly related to MS.
And actually, just one last diet question. I had a few people ask about gluten foods. Is there any knowledge or proof of that affecting MS?
That's a good question, and it gets asked often. There are many people who either have read or believe themselves that gluten is something that they think might be a hindrance for their MS. And so they stop eating gluten, and then they feel better. There are many of us who are gluten sensitive. And if we cease eating gluten, we're going to feel better. There hasn't been a study yet looking at a direct relationship between gluten and MS. But if you are sensitive to gluten, or if you stop eating gluten products and feel better, then I say go for it. That's certainly not going to be harmful for you, and if you're feeling better, that's a good thing. It would be the same thing with lactose. If somebody is lactose intolerant and they stop eating milk products and dairy products and they feel better, then that is a positive thing. So while there isn't at this point in time any specific food group or diet that will improve the disease of MS, there are many people out there who follow diets that make them feel better. And I always worry when people cut out entire food groups, but if you're sensitive to it, you might need to.
Great, thank you. I think we have time for a few more questions here. Bear with me for a second. We're talking about what to include in your diet. I did actually have a few people ask, is there anything that they should exclude from their diet?
I can't think. Well, no, I'm just giving it some thought.
Sure.
There would be, with individuals, there might be some things on an individual basis that somebody might want to exclude from their diet. If they're drinking a gallon of Coke a day, I would say there's a place to start. But as far as any particular food group that you should exclude from your diet, no, I cannot tell you that there is anything across the board. But again, individual by individual, there may be foods that aren't good for a person because of their body and because of how their gastrointestinal system works. But as far as the disease of MS, no.
Okay, thank you. Here's another question. I know that MS is more common in certain areas than others. If you have MS, can the area you live in affect the course or severity of the disease?
Great question. Thank you for asking that. Our thinking today, and has been for a while now, is that it's where you live prior to the age of 15 that either raises or lowers your risk of MS. So if you were born and raised on the equator, and lived there until you were 15 and then moved, your risk of MS is the same as a person living at the equator. If you were born and raised in Chicago and then moved to the equator, your risk is going to be that of Chicago, not of the equator. So
Great,
I hope that clarified that for you. So many people say, when I lived in Denver, they used to say, well, shouldn't I move to Denver? I feel so much better here. But usually when we talk to folks, they were feeling better because they were out there having a good time. Or they go to the shore and they say, boy, I need to move to sea level. I feel so much better here, because they were kind of hanging around on the beach and having a good time. We haven't really found that any particular part of the country, short of being too hot, too humid, too cold, too humid, those kinds of things, we haven't found that being at altitude, being at the beach, being anywhere is affecting the disease of MS, although some people do report feeling better when they're in certain areas versus others.
Great, thank you. And we have time for, I think, a few more here. Do you have guidelines or suggestions for someone that's trying to balance fatigue and exercise, or maybe guide them to some information?
Yes, I do. I often, in my practice, I would talk to people in my best knowledgeable way about, you need to exercise, and then they're sitting there looking at me and the eyes are rolling like, yeah, right. I understand. And when you're really fatigued, the thought of having to exercise seems just enormous. And you're thinking that can't possibly be good for me. And the point is that in general, this is just a general statement. People who exercise and go from sort of being sedentary and then begin to increase their level of fitness, they will have a higher endurance level, and their fatigue level will go down. And you're sitting there tonight and you're thinking, yeah, but it's true. But what you have to do is you have to learn how to exercise. You don't start in by going down to the 24-hour fitness and having somebody in Lycra telling you that you need to, be on this machine and that machine and whatever, and then like all of us who go to the clubs, say after 3 or 4 times, well, that was a bad idea. What you need to do is learn how to exercise. And my best recommendation for you is not doing it yourself, but having someone who knows something about exercise help you. And a physical therapist is the best way, or an exercise physiologist who understands MS would be a wonderful person to talk to, because they can start you out at a low level and then teach you how you can slowly increase your level of exercise so that you're not wearing yourself out and beating yourself up with exercise. And I can just tell you that people that have gone through our Can Do program have learned this and have found it to be incredibly helpful. We also have always learned about exercise. You go for the burn. You go till you're sweating and dropping on your nose. No, not the way that you do it. Not for any of us, quite honestly, and certainly not if you have MS. And so what we try to teach people is how to figure out what their exertion level can be and still be talking and carrying on a conversation, not just going for broke. And with MS, every day is not a great day, is it? All of you know that. And so on some days, your exercise may be quite limited because you're just not having your best day. And yet on other days you're feeling much better and you're able to exercise more. That's what guides you. It's how you're feeling on that particular day as to how much exercise you can do. So if, last week you were doing 20 minutes on your exercise bike, and this week you're not having such a great week, and 10 minutes is about all you can do, well, hooray for you. You're doing 10 minutes on your exercise bike. And that's good enough. And then as you begin to feel better again, because MS is up and down, then you can increase that again slowly. But the whole point is to keep at it and then to be able to achieve that level where you feel comfortable.
Great, thank you. I think that's all the time that we have for questions. Before I go into the closing, I seem to recall an article that was written by you, Pat, that is on our website, mscando.org, under the Can Do library, where you talked about enjoying the sun safely. And after you talked about vitamin D, I did have a few people ask that question about enjoying the sun safely, and that I know is a great reference for those on the webinar this evening. Yeah.
Yes.
So, thank you so much, Pat, for tonight's presentation, and to everyone who joined us. As always, very great questions from the audience. So let me go into our closing. I just wanted to share some information on the new book that's been released by Can Do MS. It was released just this past summer, and it's The Guide to Lifestyle Empowerment. And it was co-authored by several of our program staff, and it was edited by none other than Pat Kennedy, who was your presenter this evening. Again, she's a registered nurse and nurse practitioner who's been working in the field of MS since 1987. And to find reviews and purchase the book online, please visit our website. Again, that's mscando.org. And more info on the book is listed under the Programs tab. And the next monthly webinar will be on June 11th at the same time, 8 p.m. Eastern Time, and the topic will be Aging and Multiple Sclerosis. The presenters that evening will be Can Do MS program consultants Gail Hartley, who is a nurse practitioner, and Terry DiLorenzo, who's a psychologist. So please join us live that evening from the convenience of your home or office at no charge to you. You can register for the Can Do MS webinars, again at mscando.org under Programs. And for those participating live tonight, once the presentation is over, you will see a survey appear on the computer screen. And if you could please take a moment to complete the survey and share your input, that'd be great. Your feedback helps us to continue to improve our webinars. And everyone will also receive a copy of tonight's webinar slides by email. Thanks everyone again, and have a great night.